Prior to April 2017, I was experiencing a lot of numbness in my fingers, and I couldn't quite understand why they kept falling asleep. And I mentioned it to one of my doctors, and he said I needed to see a neurologist. And that neurologist referred me to Dr. James because he said it was a neurological issue. So that is when I had my first surgery with Dr. James, and that was April 2017. Just the past several months, I noticed that I was having a lot of issues with my leg, and that it would throb when I would stand, it would throb when I would sit, it would throb when I would walk. So it made sleeping even more challenging, which caused a lot of sleep deprivation. I followed up with Dr. James because my surgery for the posterior cervical was such a success. I wanted to meet with him to see what was going on with my leg. So that surgery took place August 2018. And of course, it was also a success. Dr. James took the time to explain to me exactly what was going on with my lumbar. He helped me understand that the compression is what's causing the nerve to throb. And he explained to me that because I had waited so long, that's strictly due to my high tolerance to pain. But because I waited so long, it was just one of those types of surgeries that had to be taken place immediately. He reassured me that creating space in my vertebrae would provide the relief for the nerve to resume back to its normalcy. I was a little concerned because, again, I had the first surgery with him, but I was confident in his ability to ensure me going back to my normal state. It may be a little different normal state, but I would not have the pain that I was enduring prior to the surgery. As you can imagine, preparing for surgery is a challenge because you're filled with anxiety, you're filled with a lot of anticipation, you're not sure how things are going to turn out for you. But I was reassured that day of the surgery by Dr. James, as well as Mario, his nurse, that everything would be just fine and to relax. One thing that Dr. James kept telling me is to trust God, and that's exactly what I did as a believer. It made me feel extremely confident that he felt that way as well. When I woke up from surgery, I felt no pain. I immediately felt like, okay, this was the right choice for me. When Dr. James came to see me, he reassured me that everything worked out incredibly well, that he was able to decompress the area where the lumbar had started to close in. He reassured me that everything would be just fine. And as of today, I am doing incredibly well. I'm out walking my 30 minutes per day. I'm able to do a lot of things that I couldn't do prior to the surgery. I'm able to sit in a chair. I'm able to stand up, not feel like there's throbbing. I feel pretty much like I did prior to the surgery. So once again, all I can say is that he has done a magnificent job in taking care of me with my posterior cervical surgery, as well as this posterior lumbar surgery. I'm very, very pleased with the outcome. I am doing incredibly well. I'm looking forward to my follow-up for my 6-week appointment with Dr. James on the 28th. I'm quite sure that he will be just as pleased. I'm looking forward to starting my physical therapy shortly thereafter. So right now, I'm doing well. There is no pain. I'm feeling very, very good. I had to first understand what radicular pain meant, meaning I was experiencing things that would take place after the nerve is no longer compressed. And once I understood those types of factors, everything started to fall into place. A Tylenol did it for me, and I'm doing incredibly well.